About 7 in 10 Americans say that healthcare is broken.
That number has not budged in the last 25 years.
How do we fix healthcare so people pay less, have more choices, and get better care that leads to better lives?
We want to bring affordable healthcare to everyone in the United States, and it's about bringing it to every part of the country, which is why we focus on using technology to scale us. That's really what we want out of Medicare.
And so the next thing becomes, how do we afford that? Because if everyone can offer low costs and grow quickly, everyone would do it if they could do that profitably. And that's really driven by the Clover Assistant. The Clover Assistant's goal is to drive net improvement in decision-making for physicians. When a physician pulls up the Clover Assistant for their patient, our member, because the Clover Assistant is personalized for that physician, for that member, for that specific visit, we will present everything from misdiagnoses, machine learning suggested diagnoses, treatment planning suggestions, down to med regimen recommendation, dosage level recommendations, testing or diagnostic testing that's required.
Doctors can spend more productive time with patients because they aren't searching through medical records or duplicating tests. The information is all at their fingertips. They can focus less on the paperwork and more on the patient.
The way we built the technology is actually combining the data with the human interaction of a primary care physician and the patient, and together the information and the relationship is what really improves the outcomes.
80% of individuals in Medicare have at least one chronic condition. 68% of individuals have 2 or more chronic conditions. And when we think about what happens when chronic conditions exacerbate, they lead to hospital admissions, emergency room visits. That leads to skyrocketing costs. So as we improve decision-making, we're lowering downstream costs. At Clover, we built a true virtuous cycle. We start with really obvious plan design, wide choice for consumers, lowest cost. That's led to growth of membership with Clover. On the other side, we've deployed Clover Assistant, our point-of-care platform, down to thousands of primary care physicians. As our members see those primary care physicians, that feeds more data into Clover Assistant, allows us to make more and more intelligent suggestions to those physicians that drives improved decision-making for their patients, our members. That in turn leads to lower costs, improved outcomes. We take those savings and feed it back to consumers in the form of even lower cost plans, improved benefits. We continually expand into more markets and bring that cycle to more and more markets.
So Clover's growth is intrinsically tied to this virtuous cycle among doctors and patients and the health plan that binds them.
Because of that groundbreaking difference, since 2013, we've been one of the fastest growing Medicare Advantage companies in the country, with a 38% annual growth rate compared to an 8% industry average. And we aim to bring the same disruptive business model to every corner of the country.
We've developed disruptive technology that enables us to drive systemic change on a nationwide scale. Instead of building narrow, closed provider networks, we build wide and open ones. Instead of using data to boost billing, we use it to empower physicians to do what they do best. Instead of excluding sick patients based on where they live or how much money they have, we're focused on making everyone healthier, regardless of their health, wealth, or geography.